This is the Emergency Medical Minute, sponsored by Health One.
I'll turn this thing on. Okay. So actually twice this week I have admitted patients, both youngish females, depending on how young you are personally, with heart rates in the 30s. So we'll just go through an exercise here. So somebody's walked back from triage, like their heart rate's in the 30s. What's the first thing you want to do? Put pads on. So I think I put pads on at like number 3. What's the first thing before putting pads on you want to do? What's that? Louder. Airway, breathing, circulation. There you go. This man's been in training. Yeah. So my heart rate has been documented in the 30s, 34 on an EKG. So yeah, make sure that that's not just their resting heart rate. So probably the first thing you want to know is, are they symptomatic, right? Are they having chest pain? Are they dizzy with this? Are they tolerating it well? I would say second thing would be get their blood pressure, because if they're bradycardic and their blood pressure's okay, you know, all of a sudden we kind of ratchet down the emergency level. If their heart rate's in the 30s and they're hypotensive, then we need to act more quickly. I would say get the pacer pads on early, get an EKG early, and don't freak out. So both of these patients ended up getting admitted, although they had two different things. We'll pass around the EKG for this one. We'll start with this guy, airway, breathing, circulation. What's that? My zip code, 80111. For all you Medical Minute podcast listeners, that's my zip code. All right, so one of my patients was in her 30s, one of my patients was in her 50s. Both are pretty young to be having those kinds of cardiac issues. And the EKG we're passing around right now, what's your read? What do you think? Complete heart block. Okay, so what are some of the common things that can cause complete heart block? Toxicology, yeah, so specifically if they're taking a beta blocker or a calcium channel blocker, anything that blocks the AV node can give you complete heart block. What are other things? If you've been traveling back east and hiking in the woods and now got this funny rash on my chest, Lyme disease, so you gotta check the patient for a tick and pull off the tick. You might magically cure their complete heart block. Infiltrative diseases, so if they have cancer that's infiltrated the heart, sarcoidosis, things like that. And then unfortunately, about 50% of the time, it's not very exciting. It's just degenerative conductive disease. And that's what it was felt to be in the case for the EKG that you're looking at right now. So the first case was a patient who was in her 30s, and her heart rate was in her 30s, but she was in normal sinus rhythm. Blood pressure was normal, but she felt weak and dizzy, had been passing out that day. She just got admitted and got observed. The second patient really had no medical problems, but was truly in complete heart block, had felt dizzy, had passed out that day. And she, on the other hand, went pretty quickly to the cath lab. They did coronary angiography. It was fine, clean coronaries, good ventriculogram. She's got good squeeze, normal echocardiogram, essentially normal labs. You need to check things like TSH, and she got a temporary pacer that night. So kind of sucks to have a temporary pacer, but that was what she needed. So again, just ask them right off the bat if they're having chest pain. Get the blood pressure quickly, get the pads on, get an EKG. That's it. Thanks.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.